Welcome and thank you for joining us at our Partnerships for Life webinar. I'm Luke Bayliss from the International Association for Suicide Prevention and also the Australian Institute for Suicide Research and Prevention. I'm pleased to be co-chairing today's webinar with Professor Kairi Kõlves for the Partnership for Life program. The program which aims to establish a regional and global network of experts to advance suicide prevention at a national level. And the theme for today's webinar came out of a commentary paper that really was an organic development from the Asia Pacific conference in Bangkok last year. And so we really wanted to continue this theme of uplifting minority voices in the Western Pacific region as a key priority for regional suicide research. Our first presenter will be Dr. Devina Nand, who is the Head of Wellness at the Ministry of Health and Medical Service and plays a critical role in developing and implementing strategies to address and mitigate the impact of non-communicable diseases such as cardiovascular disease and mental health. With a background in medicine and public health, she has played pivotal roles in health reforms, research and capacity building initiatives, bioterrorism, and many others, including the decentralisation of outpatient services and international collaborations on the epidemic response. So please let me welcome Dr. Devina Nand, who we're thrilled to have with us today.
Thank you, Luke. Bula vinaka and namaste, everyone. On behalf of my team, it's a great pleasure for me to present to you today on something that we're very passionate about in Fiji. And excuse me. Right. We're from Fiji. We're presenting today on the National Committee on Prevention of Suicides, which is a committee that's been established to assist the Ministry of Health in combating the enormous rates of suicide we see in this country. We do understand that suicide is a critical public health issue in Fiji. And we see ranges of completed suicide around 72 to about 105 cases per year. In 2024, we saw about 99 completed suicides in this country. And what NCOPS does is it plays a central role in addressing the suicide issue through national strategies, and we ensure a very community-centered approach with engagement of the civil society organizations within this committee. What my presentation will discuss is basically strategic directions and some community-led initiatives that we use in Fiji. As I have alluded to, suicide has been of increasing concern in this country, not only with the adolescent population, but of recent with our senior population as well. So we've seen an increase in suicide rates across. The risk factors.
Sorry, Devina, can I just
Sure.
chime in? We can see both your first and second slide. Just wondered whether you wanted to change that to the full screen of the one slide.
Absolutely. Just give me a second. There you go. Is this better?
Yep, that's the one slide. Thank you.
Let me just change the slides. My apologies. I'm just going to escape out of there and read this. I was on risk factors. So some key risk factors that we see are previous mental health conditions, including depression, anxiety, and stress, social determinants like unemployment, family violence, substance abuse, and of course, limited access to psychosocial and mental health care services, especially in rural and remote areas. And if you know Fiji, we have a few of these areas in the maritime spaces and also in the interior of many of our islands. And of course, we all as a group understand the deep emotional scars and social scars that suicide leaves in our communities and individuals and families. What we have done in this country, in Fiji, is that we've developed a national framework to address this issue of suicide. And one of the things that that we have are some key strategic directions, including national policy on suicide prevention. We have a plan, and including mental health legislation. The Mental Health Act is currently under review, and with this, we will be reviewing quite a few of the national documentation, including the policy and the action plan on mental health and suicide prevention in the next few years. We do a lot of strengthening around mental health services because while working with our civil society organizations, because they really are community engagement specialists on the ground. And they help to build both trust within the community and improve health promotion in these areas. With suicide prevention and mental health, we've integrated with the greater non-communicable disease space. And this helps one to realign resources and integrate some of these initiatives across many other non-communicable disease frameworks as well. We have very good coverage of prevention activities that we do with all our media spaces, and the little note in blue calls that we've been doing a lot of training and with nurses, doctors, and also the community when it comes to prevention of suicides and good mental health within the country. Now, what is NCOPS? NCOPS is basically the National Committee on Prevention of Suicides. It was established in 2003 by the Ministry of Health, and it looks at comprehensive mental health and suicide prevention reforms in Fiji. That's closely linked to our plan, our strategic plan. What is important to understand is that this actually garnered very high political engagement and is currently chaired by our Minister for Health and Medical Services. And it has been continued to be chaired by the Minister, the Honourable Minister, since 2003, and co-chaired by the Permanent Secretary for Justice. What this does is allow a lot of our actions and interventions to be visible at political level, at government and cabinet level, and therefore we garner resources and support at that level, cascading down right to our civil society organizations and our communities. What NCOPS does is that it is a sectoral coordination body and includes the Ministry of Health, Education. We have a few of our civil society organizations. And what the committee does is it focuses on policy development, public awareness campaigns, integrated across our CSOs and various ministries. Strengthening mental health services and coordinating cross-sector responses to suicide prevention, but also to positive mental health in the community. And our ongoing commitment by the committee is, again, highlighting the issues around suicide and emphasizing on early intervention, especially access to psychosocial services, engagement of the public, and of course, health promotion as a mainstay. Now, NCOPS with the ministry leads this approach. And what we do as a ministry is we share appropriate knowledge, methods, and lessons learned, as well as suicide-related data and research. I would like to add that the suicide-related data are as a result of the engagement with the Fiji police, and they're an important component of this committee. And it helps us promote openness and responsibility. It also helps us realize that there are various players within the society, and engaging all these players are necessary for interventions within this space. NCOPS, as I've said, is led by the Minister for Health and Medical Services. And I'd like to give you just a brief. NCOPS was actually started by one of our ministers for health in 2003 because he actually lost his daughter to suicide. And this garnered all his support and has since garnered support through all the ministers for health and cabinet on interventions, and raised the profile of this committee and the work it does. Now, the goals, of course, prevention of suicide and, of course, improving awareness programs and enhancing access to services. Enhancing community suicide prevention, social support services and networks, and improving standards on provision of care, those who need it, and improving research and M&E around matters concerning suicide to improve our program and our approach in our communities. One of the things that we do as a committee is we steer the development and implementation of integrated suicide prevention delivery plans. And these are discussed at the level where all the CSOs are engaging and actively sharing their plans, interventions. And this allows us also to integrate with the various community players in terms of providing standardized information, messaging, and other pathways for support to the community, such as helplines, standardized IEC or social behavior change comm materials. We're reviewing policies, strategies, and counseling standards. So with the work of the NCOPS, we managed to establish counseling standards within hospitals, and now we have a guideline on this. We're improving sort of the national attitudes to its suicide prevention community by community through districts, schools, and community workshops. And these have occurred in various spaces, even with families, workplaces, and other health promoting settings. We incorporate family life education into the national school health curriculum. So the Ministry of Health works with the Ministry of Education to review all its curriculum, including mental health or any of the health curriculum. And we liaise with government authorities to promote strategies for reducing psychosocial stimulants that have been implicated in suicide. So one of the committees that we work with is the National Substance Abuse and Advisory Council that is legislated for, and again is a part of the NCOPS as well. As I've mentioned, we collaborate with the NGOs working in the field of suicide prevention or mental health, and other educational authorities. We work with health promoting schools where one of the pillars is mental health. And as I've mentioned, we work very closely with the Ministry of Education in curriculum development and review. And of course, promoting research as best evidence. And this is a huge gap in Fiji, so we would like to encourage collaborations on this front, because again, research and best practice is critical for programs. We have a lot of challenges. Again, I think similar to many countries, there's still stigma surrounding mental health. There's a lot of cultural sensitivity. And because of this, our approaches have to be tailored to the culture. And as you know, Fiji is a very diverse population. We have the indigenous population, we have migrant populations. And so all these sensitivities have to be taken into account as we expand the program. And of course, linguistic knowledge as well, because of the diversity of our population. And I've mentioned that we have a lot of geographical barriers. A lot of we're made up of over 332 islands. A third of them are inhabited. And because of this, really getting the reach to maritime areas and the interior is quite difficult. And there's also a lot of lack of awareness within our population, especially around services that are available. So we're working on that. So this is it from our side. Thank you for listening to us and giving us time to present the Nakavaka level.
Thank you, Devina, for a very interesting presentation about different activities in Fiji. It's my great honor now to introduce our second speaker. And Dr. Mandy Gibson is a research fellow together with me at the Australian Institute for Suicide Research and Prevention at Griffith University. And she does research on protective factors and initiatives to reduce Aboriginal and Torres Strait Islander suicide. She's also practicing psychologist with over 15 years of clinical experience across the spectrum of youth mental health and suicide prevention, including emergency department risk assessment, community outpatient treatment, and public health program development. So she will be talking a bit more to us on what she is researching at the moment. Welcome, Mandy.
Thanks, Kairi. Just want to check that the screen's working okay. All good?
Seems to be coming up.
Awesome. Just what we're looking for. Wonderful. I'd like to firstly acknowledge the traditional owners of the lands of which we're meeting. I'd like to acknowledge that I'm presenting today from the Yagara Jarana, the unceded lands of the Yagara people, the traditional owners and custodians here. I'd like to pay my respects to elders past and present and acknowledge their enduring connection to the lands that I'm on today. And also acknowledge the harms caused by actions of historic and continued colonisation, which have sought to diminish that connection, the impacts of which we see in the disproportionate burden of suicide experienced by First Nations communities still today. So some context just for our international audience, probably similar types of patterns around this region of the world, unfortunately, but these injustices against First Peoples has included forced removal from communities off their traditional homelands, genocide, dispossession and discrimination, and majority of these actions were actually enabled by the paradoxically titled Protection Acts, which provided state governments specifically with power to control wages, if wages were received at all, because it also allowed for forced unpaid labour, control who Aboriginal people could marry, who they could interact with, where they could live. You may have heard of the Stolen Generations, which deemed all First Nations people under 21 as automatically wards of the state, and any First Nation children were by definition legally deemed as neglected. or if you had a single First Nations grandparent, you could be automatically deemed neglected and removed without investigation. Through these policies, between 10 to 30% of all Aboriginal and Torres Strait Islander children were removed across the country. And these protection acts remained largely in place until the 1970s, with some provisions only later overturned in the 90s, such as being able to legally pay First Nations people less for the same job. And many would argue that many of these components are still alive and well today, particularly in terms of access to land and sacred sites. So these prolonged and institutional harms towards First People are implicated in the systemic inequalities experienced across many facets of life today. And unfortunately, one of the most pronounced is in suicide disparities. Similar to other First Nations communities across the world and in our region, Aboriginal and Torres Strait Islander people die by suicide at a significantly higher rate than other people in Australia, and young people are particularly overrepresented. While the age standardised rate for the whole population is a bit over twice as high for Aboriginal and Torres Strait Islander people. For young people, particularly those under 15, our youngest Australians, Aboriginal and Torres Strait Islander people are almost 1 in 4 of the suicides, dying by suicide almost 8 times the rate of other young people. So despite being almost 1 in 4 of our state's suicides, 1 in 4 programs, 1 in 4 dollars, 1 in 4 program investments are sadly still not directed to this community. And sadly, we've had evidence that this has been happening for a very long time. While it's obviously very important that we have good quality data to be able to hold governments to account and track changes and make sure that we're going the right direction, there's been a lot of criticism that just reporting on these gaps without exploring any potential or preventative factors contributes to that dominant deficit approach to First Nations suicide prevention, particularly those assumptions that these higher rates are just inherent or intractable. And it particularly hinders identifying effective strengths-based solutions that really focus on Indigenous cultures or strengths within our communities. In fact, there's very limited evidence at all that this data has led to changes for First Peoples or even more programs. As part of our work as a World Health Organization collaborating centre, we a couple of years ago looked at all Indigenous suicide preventions globally. And in that process, we found only 3 reporting improvements for First Nations young people in Australia, and then only 1 more for Indigenous adults in Australia. So obviously there are many reasons why there's for that disparity between these high rates and this limited evidence. But a key factor, of course, is the really different suicidal trajectories, the different protective and risk factors experienced by First Nations young people, which are often either misunderstood or just unmet in many of our traditional screening or mainstream models and services. For example, some analysis we conducted here again in the state of Queensland, where AISRAP is based, we found that First Nations young people who died by suicide, as compared to non-Indigenous young people, were less likely to have had mental illness symptoms or communicated intent. And as these classic things, mental health issues and reported intent and ideation, primary screening factors within many of our triaging models, it's not surprising that Aboriginal and Torres Strait Islander people who died by suicide were less likely to have ever been seen for mental health support or psychosocial assistance. Which means we know that we need strategies to build resilience to suicide at the whole of community level, to promote protective factors in order to reduce suicide, that we can't just rely on models which seek to pick out which young people are at risk or at need support. We can't put all of our eggs in that basket when we know that we are missing the key factors or they're not experiencing many of our key risk factors. And also importantly, Aboriginal and Torres Strait Islander young people often experience many risk factors for suicide, which are absent or at least not central within a lot of our screening and risk management models. Of course, most notably here, of course, is experiences of racism and discrimination, which research unfortunately shows globally are associated with increased suicidality for Indigenous peoples in every community. And which some studies in Australia have actually reported a stronger association with racism and discrimination, those experiences against suicidality, compared to many, classic risk factors such as gender differentials, poverty, exposure to substance use, many of the things we do classically include in our models. And I guess putting aside a lot of those questions of whether we want to look at risk factors or protective factors, and whether we think that looking at the impact of culturally specific risk factors, surely that will show answers or highlight pathways for our interventions. Putting aside and going back to our initial acknowledgement of country, it's been widely accepted in Australia that the current suicide rates are related and caused by impacts of historic and continued colonisation and discrimination. But that hasn't proportionally informed our suicide prevention approaches or our research and clinical approaches even. That if community dispossession and cultural dislocation are why we're experiencing these elevated rates, then surely community empowerment and cultural connectedness should be logically examined to inform our preventative approaches. And that's the overall question behind the larger research project that I'm presenting some of today, is whether cultural connection is associated with reduced suicidality for First Nations young people in Australia. Unfortunately, in Australia, we are quite limited in the cultural data that we have access to. I guess in other countries where there are treaties or sovereign Indigenous nations that have data collection power, there's a little bit more available. But fortunately, we do have a census conducted with First Nations people every 6 years that looks at engagement with culture, looks at health and well-being, education, all the classic things as well. Unfortunately, because First Nations people are only 3% of our population and spread across the entire country, it means that any kind of small area community level data has a very high risk of identifying individuals. So our friends at the National Centre for Socioeconomic Modelling have helped aggregate survey responses and from that survey and benchmarks them against the standard national census that the rest of the country takes as well, to be able to get reliable small area estimates of social and cultural indicators for Indigenous populations in Australia. I won't go through how these items are created and the errors and everything like that, but please get in contact with me if you do want to talk about it further. I think my email will be at the end. So the indicators we've selected for this study to assess the impact of community level cultural connectedness to compare suicide rates by high and low levels is Indigenous language use, so the percentage of First Nations people who speak an Indigenous language at home. We've also looked at a multi-item composite index, which looks at cultural aspects of community social capital. So percentage of First Nations residents that attend ceremonies, cultural events, access Indigenous specific services, and as well as the overall capacity to give and receive support within your community. And we've also looked at the percentage of Aboriginal and Torres Strait Islander people in each community who report they experienced discrimination in the previous year. And we've also looked at other general risk and protective factors such as community resources, just socioeconomic resources, remoteness, such as distance from goods and services. So looking at our first rounds of analysis, as you can see up at the top, looking at that cultural social capital, we found that communities where First Nations residents had greater involvement with cultural events, activities, and attendance at ceremonies and specific Indigenous organisations, First Nations young people died by suicide at a significantly lower rate. It's particularly noticeable when you look at the socioeconomic resources, where that difference actually didn't reach significance, suggesting that the cultural and social support had more impact on youth suicidality compared to the education and income and other indicators of poverty or advantage. And particularly looking at that discrimination, noticing that, I guess is probably the main thing I just want to hold for just a second, that in communities where Aboriginal and Torres Strait Islander people reported being discriminated against in the previous 12 months, Aboriginal and Torres Strait Islander young people ended their lives by suicide at more than 2.5 times the rate. Now, obviously, those are stark findings, but also promising, particularly the impact of that cultural social capital. But a big limitation here so far is that, particularly looking at a multi-item index, there's a lot of different components to that, and it's really hard to know which part is protective. For example, there could be other associations underlying that and explaining that. For example, engaging with more Indigenous services could just be there's more Indigenous services to engage with, or feeling more confident to give and receive support could just be you have more resources to give and receive. So in our next analyses, we wanted to look at those indicators of cultural community engagement and connectedness to see if they were protective beyond these possible correlations, which was particularly important because we did notice quite a lot of correlation between these factors. As you can see here, the only one that didn't have any correlation, or wasn't significantly correlated rather, was socioeconomic resources and racism and discrimination, meaning that, as First Peoples tell us always, that being in communities with wealth and education does not protect them from the experiences of racism and discrimination. So in these second analyses, we looked at communities with the most socioeconomic advantage, so the least income, education, the communities the furthest from other services and support, and communities with the greatest discrimination. And noticing here that not only were most of the protective factors significantly associated with a difference, we notice here, of course, that the Indigenous language use, which wasn't actually very significant, had very little difference when we looked at it on its own. We noticed that it actually made the most difference in the communities with the greatest disadvantage, suggesting these cultural factors could actually have the greatest impact where there is the most to be protected from, which is really promising for future interventions. But looking at the furthest on the right of your screens, you can see that the greatest impact of both Indigenous language use and cultural social capital was in the areas where Aboriginal and Torres Strait Islander people reported the most discrimination, suggesting that those adverse impacts of discrimination may be particularly amenable to change through cultural interventions. And it confirms what we've seen at an individual level, whereby cultural self-esteem has buffered the effects of racism on adverse outcomes for First Nations young people in Australia, as well as our region, as well as more globally. So obviously there are a number of limitations. These are just observational associations. We can't infer that these are causative, but also we really can't presume that this is going to associate with changes over time. We really need that applied research in partnership with communities, with cultural engagement practice programs, to actually see if this is associated with lower suicide rates. But nonetheless, this really does provide evidence to support new approaches to Indigenous suicide prevention, including language rejuvenation practices, cultural engagement, and population-wide strategies to address racism as a key public health concern. And obviously, this applied research is a really important part of the work we're doing. It's very easy for researchers to show some really fun or interesting or exciting new data, but using it to make change in the real world is what really matters to what we do here at AISRAP. So we've been working to apply these findings in partnership with grassroots Indigenous elders groups and Indigenous youth mental health orgs to co-design novel suicide prevention programs using connection to culture as the primary intervention mechanism. So we've worked with First Nations facilitators to bring in elders, to bring in local cultural knowledge holders as appropriate to each region, into schools to share and yarn with young people. And we've also done that alongside local help-seeking services, just to build relationships and maybe for future vouching for kids once programs have finished. And this 6-week program, admittedly in a very, very small pilot evaluation, we've been able to deliver to 13 schools so far. And in that across Southeast Queensland, the region more broadly, up to Sunny Coast and Gold Coast range. And we found that after participating in this program, young people have felt a greater sense of connection to culture and community across a number of indicators, such as peer cultural competence and sense of belonging. And importantly, after participating in this program, young people reported lower suicidal ideation, greater self-esteem, and greater reasons for living, so that positive ideation of wanting to live in the future. Obviously, these are very, very early and preliminary findings, and there's more research to be done. But nonetheless, it really does provide evidence for trialing new approaches, especially when, as mentioned at the beginning of the presentation, there is very limited evidence of effective strategies to address the disproportionate burden of suicide experienced by Aboriginal communities here in Australia. And I just want to end by acknowledging that as researchers, it's very easy to say, like, oh, it's some of the first programs that are being developed in Australia, or it's some of the first research finding a buffering effect of discrimination, of culture against discrimination on suicide rates. But I want to acknowledge that when we say it's new evidence, this isn't new on these lands, that yarning and sharing culture has been happening for millennia. And elders and Indigenous scholars alike have constantly advocated that connecting to culture is critical to positive youth development for Aboriginal and Torres Strait Islander young people, but also is really central to healing the harms of discrimination and historic and continued colonisation. So thanks very much. I'm looking forward to chatting with you all soon.
Wonderful. Thank you, Mandy. It's good to see you add into the evidence base of culture and how it can help improve lives, really taking a strengths-based approach. So thank you for your time today.
Thanks.
We'll now go to our final presentation, Sarah and Linda. Sarah and Linda are both with the Te Ata Hāpara Suicide Prevention Research Centre, University of Auckland. Please forgive me if I'm not pronouncing this correctly. Te Ata Hāpara prioritise youth voice and co-design in our work, all of which is undertaken under Te Tiriti o Waitangi. Their research is focused on real-world implementation. They're connected with services, stakeholders and communities across Motu in all the work that they do. Thank you and welcome.
Kia ora everybody, Linda Bowden no Aotearoa hau. Do you want to say kia ora?
Kia ora, well, Sarah Hetrick.
So we're coming to you from Tamaki Makaurau here in Aotearoa, and firstly we just also would like to acknowledge the Indigenous owners of our lands here, mana whenua in Aotearoa, ngā iwi o Aotearoa. And also that additionally, ideally today we would be presenting with our Indigenous team who are not here today. So the purpose of our kōrero today, our talk, is to share with you our experiences to date around navigating worldviews in suicide prevention research, and I guess who we're prioritising in that. So, just to give you a little bit of context, the context of Aotearoa, New Zealand, we're a little country, southwest, I was going to say east, east of Australia in the southwest Pacific Ocean, and we've got a population of 5.2 million. 17% of that entire population are our Indigenous tangata whenua Māori population. We're made up of 3 major islands and some small islands, and you can see in the 2 different maps that get presented over 100 iwi on the right-hand side, and a mix of te reo Māori, which is the Indigenous language of our Indigenous people, and English on the left-hand side. So the founding context of Aotearoa, in which we live and breathe and do our work on here, is Te Tiriti o Waitangi. So some people refer to this as the Treaty of Waitangi, but it's the founding document of Aotearoa. So Te Tiriti o Waitangi was signed in 1840 by the Crown and our Indigenous Māori leaders. There are 2 texts. The intention was to legitimise the settler presence in Aotearoa. However, given that there are 2 texts of the treaty, both English, one in English and one in te reo Māori, there are discrepancies, as we can imagine. The Māori language version never ceded sovereignty to the Crown. The English version did. And so we can imagine, as Mandy was describing before, the amount of injustices that continue when there are 2 different texts. The Māori text agreed to governorship and, as we said, didn't cede sovereignty, affirmed full and undisturbed possession of lands and treasured possessions, including health, and conferred the same rights and privileges to our tangata whenua Māori as British subjects. The United Nations Declaration of the Rights of Indigenous People recognises that we should observe the Indigenous language version, which means that there would be equitable health and other social outcomes from Māori, and also that it's a right. It is an expectation that we honour Te Tiriti in everything that we do, and therefore research in Aotearoa fulfills our obligations in honouring of this Te Tiriti. One of the ways that we do that in Aotearoa is we use, particularly in Te Ata Hāpara, is we use Hiawawhiria, which is an approach that is Te Tiriti-led. It ensures partnership, protection and participation of all people, and that we do that through co-leadership and intentionally prioritising the tangata whenua perspectives, our Indigenous people. So today we're going to talk to you a little bit about how we do that in the research, and ultimately answering who do we prioritise in the processes that we use. The Tiriti principles are built on 5 key things, so partnership, protection, equity, tino rangatiratanga, and redress, which I'll talk a little bit about. So in doing that, we use what we call kaupapa Māori principles, which you can see here. So tino rangatiratanga is around self-determination and independence and autonomy, around power and control that lives and rests with tangata whenua understandings and practices. This is really, really important. And part of that is around ensuring that in everything that we do, that we are honouring the aspirations of tino rangatiratanga in that. Social justice is around seeking the redress to ensure that there are restoring power balance and that there are benefits and outcomes to our Indigenous people, that the Māori worldview, the Māori way of being and knowing is upheld and takes precedence over the others. Whakawhanaungatanga, a key kaupapa Māori principle, everything is built on relationship and connection, and Sarah will talk a little bit about that later on. Te reo Māori, as Mandy said, the language is key, right? Language is culture. It's fundamental and should be used accordingly. Whānau, so the meaning of family, your entire collective unit in Aotearoa is the crux of how we do the work. Typically in Aotearoa, our suicide rates, and we've heard already around Indigenous experience of this globally, is almost twice as high for Māori. So 16.0 per 100,000 and for tangata whenua compared to our non-Māori, which are 9.0 at our national level. Our suicide prevention research is predominantly Western-centric, with lots of research that is funded for prioritising Western treatments, not necessarily kaupapa Māori solutions, and doesn't always address the impact and ongoing injustice of colonisation and the social drivers of suicide. Therefore, we posit that we need to move towards using kaupapa Māori researchers in order to actually address inequity.
I won't talk a heap about this, but Moana Jackson is somebody who is big in our world and who has come up with these ethics of research from a Te Ao Māori perspective. And I guess just to quickly point out a couple of things, and you'll see the parallels between what Linda's just presented about kaupapa Māori approaches and this ethics of research from a Te Ao Māori perspective. So I've highlighted there the ethic of change, and that all the research that we do should be dedicated to the role of changing the realities in which people live, and that ultimately is about addressing colonisation and ensuring equity in everything that we do. I haven't highlighted time, but I do love talking about the ethic of time as Moana Jackson talks about it, because I think it everyone who's on the call will really relate to the timelines that Western funders and our institutes put on us to do these pieces of research and deliver our pieces of research. And actually there is a distinct Māori notion of time which kind of allows the ebb and flow, and allows what Linda and I will talk about as the process to be the thing that drives us, not the outcome and the timeline. So mā te wā is a beautiful construct of, in its time, because sometimes if we push things right now, it's not the right time. And actually, you probably all had that. Sometimes if you leave things for long enough, actually it becomes clear that that was the right thing to have done to allow the ebb and flow of time. That's not what our funders think, but to do things in the right way, prioritising relationships and prioritising, the process that is a kaupapa Māori process will mean that time is a different construct. The ethic of power is about the power of research, where there's a reciprocal obligation to be respectful. So if knowledge is power, whose knowledge are we using? The coloniser's knowledge, or mātauranga Māori, which gives power for Māori to be Māori, and therefore for research to be ethical. And the ethic of courage, so that's about being brave in research and asking questions in a way that are transformative, and being brave enough to prioritise relationships and prioritise kaupapa Māori research processes, even though the funder might be on our back for deliverables. Hei awa whiria is a concept of braiding. You can see this is a river in the South Island that gives you a beautiful example of the many strands that come together, again in an ebb and flow. That is about bringing Western knowledge and mātauranga Māori, or Māori knowledge together in a way that creates a new thing. And we have Professor Angus McFarlane, so acknowledging his work. And he brought that work to a really large piece of work that we did called a National Science Challenge. And we were running the Resilient Teen theme, and we talked about operationalizing this idea as being a co-leadership approach. So we were the Resilient Teen theme, and my colleague, Dr. Tanya Cargo, and I insisted with this broader national collaborative that we would be co-theme leading, that it would be a Māori and Pākehā leadership team. And I want to talk about that partnership and talk about relationships and highlight this concept of partnership as friendship, because that's a real thing people Angus McFarlane. And I think this is what looks like. So if you think about research and we think about friendship as two different things, but actually it's the same in our world. So we think about how we operationalize or how that friendship looks in research. So this is my beautiful friend, Associate Professor Lynn Russell, and she's presenting, well, the first thing to say is we had international guests at this symposium, and our tangata whenua were the keynotes and opened the day. And we were talking about how to talk about suicide in public settings in a safe way. And my beautiful friend, our beautiful friend Lynn, was asking this question about, whose power, whose knowledge are we using here? Who are we relying on? And the point I want to make about this is at the end of the day, my beautiful friend said to me, was that okay? Was I allowed to say that? And my job, I'm not tangata whenua, obviously, but my job as ally was to use the privilege that we have to create the space and to hand over the power and to say to her, yes, that was exactly perfect. That was exactly the question to ask. That was exactly the conversation to have. This is your space. You have this space and you drive the conversation. And so what Lynn was really asking there was, whose research is it that is informing the guidance that we have in our media guidelines, for example, about how to communicate about suicide? So that's a live discussion in Aotearoa New Zealand about that. So Hei Awawhiria approach ensures partnership, protection and participation as the founding principles in line with Te Tiriti o Waitangi, and it's supported in the way we've been doing things with dual leadership and governance. And that's been now operationalised. Luke talked about Te Ata Hāpara, which is a suicide prevention research centre that we've set up. And so we have created this centre really as a way to build a home and practice the research that we do in the way that we want to do it, which is fulfilling our obligations under Te Tiriti o Waitangi, and providing evidence, but ensuring that our research is, again, you can see there amplifying whānau perspectives, that kaupapa Māori research is really the way that we're doing things. There's a range of things that we're doing in the centre, but I guess it's really about the process and the way that we do that, and that is that we have a leadership group, Te Pou Whānui. So you can see we've got our co-leadership approach, a little slightly blurry there. Sarah Fortune, who many of you'll know, Dr. Tony Cargo and myself as co-directors, but it's really Te Pou Whānui who provide the leadership and the direction for what we do. So they're not there to kind of rubber stamp our Pākehā Western research ideas. They're there to say, hey, this is where we want you guys to really be driving into in terms of the research that you do.
So how do we do that in practice? How do we prioritise an Indigenous or Te Ao Māori worldview? Is through three key things: people, process and perspective. So first of all, acknowledging many famous proverbs or Indigenous whakatauki is that people are the way forward. It's people are the most important thing. And the way in which we do that is to really prioritise our people. So we have young Māori researchers, Indigenous researchers that actually started out participating in research projects. and are now the PIs. They are now leading the research process. They've created their own groups. A summer student working in our program became, like we said, was part of the National Science Challenge. She then did her health science degree. She then began her postgraduate course, and now she's in clinical psychology training and continues to lead research projects as an Indigenous researcher. I think the key thing is that particularly our non-Indigenous partners is that we're always creating the spaces to elevate people and to ensure that those people are looked after and that they succeed and thrive and lead, that they're not just invited to the table, but that they are organising the whole house, that they are leading it, that they have all the same resources to do what they need to do for their people and for everybody else. The other thing that we do is sharing. Sarah talked about sharing of power and acknowledging relationship and process. And so, as Sarah said, sometimes it's really easy to return to the dominant process in research and think about going back to easy ways of doing things, or perhaps the more familiar way, or the more comfortable way, or the ways that are consistently promoted. And that list of research areas that we covered, you could see there it says kaupapa Māori research, and particularly things like co-design, co-produce solutions. And sometimes those things take longer, and sometimes they are hard to stick with, but that is something that we believe in very strongly, and hence the setting up of the centre to enable us to continue to do those processes, which sometimes mean we have very highly qualified professors organising things in a different way to allow us to do the process, to allow us to do the tikanga, to stay with the process. That means that we honour the process in the first place. And therefore, that gives us the ability to maintain that perspective, to thinking about the small things and not get bogged down in the detail, or to get bogged down in the systems and to end up being fallible to institutional racism and other things that occur, but that you can maintain focus on what we're here to do, which is address the equity and use the research to make change for those people.
I'm just going to highlight really quickly some of the particularly digital projects, but the relationships that we've built. And this is 5, 6, 7 years of work. So you've mentioned Annabelle, Linda. This is Kiani, who took one of our chatbots and really led work to ensure that one of the courses within the Headstrong chatbot really speaks to young people going on that cultural journey and understanding their identity, called Kia Hau Manu. This is Arabella. She's a medical student. She's one of the newer ones who have come into our team, and she did a summer student project to take one of our apps and incorporate Te Reo Māori into it. That's TuneIn. So you can see there some of the Te Reo Māori kupu that she's incorporated into that. And Bro is co-designed by Māori for Māori, and Annabelle, who Linda mentioned, led that. Now those wahine are now part of really this TIPS trial where we're testing a range of apps for suicide prevention, but it's those wahine Māori who are really driving the recruitment. They're driving, as you can hear, lots of the development of the apps, and they're ensuring that the process that we engage in to recruit young people is going to make sure that we recruit Māori into this trial. And I guess the reciprocity in that is everyone gets to spend, we have kaumātua right next door here actually, and they get to spend time with kaumātua and elders and learn more about on their journey. I won't go through all of that. I think we've covered sort of the co-lead of this big trial and stratification to ensure that we have Māori in the way that we're going to recruit Māori. I wanted to talk a little bit about process. So everyone will be familiar with ChatSafe, which have been developed in Australia, and we are adapting these for New Zealand. Now, we thought that we were being very brave by saying, actually, we're going to do Delphi as a wānanga style. So that's in person. We would have young people come in. It's like a workshop. We would go through all the items. People would still complete individually on their computer. And then we would do the analysis. We'd send out the second survey and do that again in person. So we were doing this in-person thing. We were going to look at Māori versus non-Māori data. And we thought we were being very radical. But again, what we've allowed in this process is to let the process be correct and lead. So we have really strongly resisted the need to finish off and have guidelines. And we have said, no, we're going to slow this whole thing down. So instead of being done in 2 months over winter last year, it took all of last year. And we travelled, so for example, we travelled up Northland and we did one of our wānanga at a marae. You can see that down in the corner there. We've travelled to Rotorua to work with partners down there. So we've travelled to where young people are in community. We also really messed up with the methods by taking the feedback you can see there. What is a hoax? What is this yes, no? Where's the yes, no? I hate reading, I don't understand. And I just want to say that's from the adults, not just the young people. So we simplified this, the round 2 of Delphi. We had our Te Pou Whānui Māori leadership group take this feedback, redo the survey, use better wording. And then we went back up to Northland, we went back down to Rotorua. We had another session with our South Auckland crew. You can see Kiani there and another one of our young people leading this wānanga. I don't know if you can see the large table of food on the side there in terms of the manaaki, the caring that we do for young people. So this is what the process ended up looking like, because we were very determined to make sure that it wasn't that the outcome was leading us, but that the correct process from a kaupapa Māori perspective was leading us. I won't take you through the results, but we're about to finally have some guidance. It's taken a long time. And
a lot of going back.
And a lot of, we've got this slide in here because, again, we want to look after our people, and koha, or ensuring that people's time is respected and compensated for, is really important. And I guess we will wrap up by saying that these are our top 5 learnings, and you'll notice that the top 5 learnings are all the same. It's just about relationship.
Brilliant. Thank you.
Thank you very much, Sarah and Linda, for great presentation. Very interesting. Unfortunately, we won't have time for questions. But everybody, please feel free to contact Sarah and Linda or Mandy or Devina about their presentations if you have any additional questions. But I believe we're gonna wrap up for today, and everyone who is interested, who is online and interested in Partnership for Life project more deeply, please contact Luke or myself, and hopefully we can collaborate with all of you in near future. Thank you.
Wonderful. Thanks, Kairi. Thanks, everyone.
Thank
Just a
you.
quick shout out to the chat. The meeting is recording, and recording will be available. And to see presentations that may be close to this standard, almost equal, feel free to attend the World Congress in Austria. Thanks again, everyone.
Thank you.